Today, we're talking about Kobee, a combination of B vitamins that are essential for treating or preventing vitamin deficiency. This can happen due to a poor diet, certain illnesses, alcoholism, or during pregnancy. B vitamins are crucial for the body and help maintain good health. Kobee includes thiamine, riboflavin, niacin/niacinamide, vitamin B6, vitamin B12, folic acid, and pantothenic acid. Some brands of B vitamins may also contain vitamin C, vitamin E, biotin, or zinc. It's important to consult your doctor or pharmacist if you have any questions about the specific ingredients in the brand you are using. The recommended daily dosage and the optimal timing for taking Kobee will depend on your individual needs, so it's best to discuss this with your healthcare provider. The recommended dose of Kobee is to take it by mouth, typically once a day, or as directed by your doctor. It's important to follow all the instructions on the product packaging. If you have any questions, be sure to ask your doctor or pharmacist for guidance. If your Kobee contains vitamin C, it's best to take it with a full glass of water unless your doctor tells you otherwise. For chewable tablets, make sure to chew the tablet thoroughly before swallowing. If you're taking extended-release capsules, swallow them whole. Do not crush or chew them as this can increase the risk of side effects. If you are taking a liquid form of Kobee, use a medication measuring device to measure the dose accurately. Do not use a household spoon. Some liquid forms may need to be shaken before each dose, and for those containing vitamin B12, they may need to be placed under the tongue and held there before swallowing. Be sure to follow the label instructions carefully for the best results. In order to get the most benefit from Kobee, it's important to take it regularly at the same time each day. If you experience mild upset stomach or flushing, don't worry. These effects are usually temporary and may go away as your body gets used to this product. If they persist or worsen, talk to your doctor or pharmacist. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Although it's rare, a very serious allergic reaction to this drug can occur. Seek immediate medical help if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects. If you experience any other effects not mentioned, talk to your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You can also report side effects to Health Canada at 1-866-234-2345. Before taking Kobee, make sure to inform your doctor or pharmacist about any allergies you may have to its ingredients. It's also important to consult with them if you have diabetes, liver problems, or a vitamin B12 deficiency. If you are using the chewable tablets or liquid form of Kobee, be aware that they may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this drug. Additionally, the liquid forms of Kobee may contain sugar and/or alcohol. If you have diabetes, alcohol dependence, or liver disease, it's important to exercise caution and seek advice from your doctor or pharmacist about using this product safely. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss with your doctor before using Kobee. This product is safe to take during pregnancy when used as directed, and maintaining adequate amounts of folic acid during pregnancy may prevent certain spinal cord birth defects. Consult your doctor or pharmacist for more details. Kobee also passes into breast milk, so it's important to consult your doctor before breastfeeding, even though there have been no reports of harm to nursing infants. When taking Kobee, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Kobee include altretamine, cisplatin, certain antibiotics, such as chloramphenicol, certain anti-seizure drugs, such as phenytoin, levodopa, and other vitamin/nutritional supplements. Additionally, Kobee may interfere with certain lab tests, such as urobilinogen and intrinsic factor antibodies, possibly causing false test results. It's important to make sure that lab personnel and all your doctors are aware that you use this product. When taking Kobee, it's important to follow the recommended daily dosage and take it at the optimal timing as advised by your doctor or healthcare professional. If someone has taken too much Kobee and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It is crucial to seek professional help in the case of an overdose. Remember to keep all your medical and lab appointments. It's important to note that this product is not a replacement for a balanced diet. It's always best to get your vitamins from healthy foods. B vitamins can be found naturally in leafy greens, vegetables, meat, fish, poultry, as well as enriched breads and cereals. The daily dosage and optimal timing for taking Kobee will depend on your individual needs, so it's important to consult with your healthcare provider for the best advice. If you are taking Kobee on a regular schedule and happen to miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, just skip the missed dose and take the next one at your regular time. It's important not to take a double dose to make up for the missed one. Make sure to check the storage information on the packaging of Kobee. If you have any questions about how to store it, be sure to ask your pharmacist. Keep all medications out of reach of children and pets. Do not flush Kobee down the toilet or pour it into a drain unless specifically instructed. When Kobee is expired or no longer needed, make sure to properly discard it. Be sure to consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.